So, so welcome everyone. This is our weekly conversation on human-computer interaction and the future of work. And our guest today is Professor Gregory Welch from University of Central Florida. If possible, turn on your cameras. We love to see everyone. It's part of getting the community together. And our conversation today is part of a series that is organized with Andrew Kuhn, Linda Boyle, Rafaela Sedun, John Lee, Manfred Seligi, and myself. And the first half an hour will be a recorded event. Andrew and I will moderate a conversation with Greg. And we're very much looking forward to questions from the audience. So please feel free to type your questions in the chat and Andrew will monitor the chat.
And I'll either read them or maybe ask you to ask a question yourself.
And stay with us for the second part. Following the conversation with Greg, after 30 minutes, we will turn off the recording and we'll have what we like to call kind of a social reception after a talk. We'll just be there. It's an opportunity to meet colleagues, for students to participate and meet leaders in the community. But right now, I'd like to welcome Greg. Thank you for joining us today. I know that much of your focus this day is on virtual agents. And what do you think are the opportunities for using virtual agents for supporting healthcare workers, and in particular nurses?
Thanks, Orit. So for those of you who don't know, I'm a computer scientist and engineer, but I'm actually have my primary appointment at UCF is in the College of Nursing. So it's a little odd. I can't teach any nursing courses directly, but I'm collaborating a lot with nurses. And so I get to know them and really understand. Over the years, I'm really starting to understand the challenges they face and sort of what technology things might be appropriate or not. But with respect to agents, or one of the, there's sort of at least two big things that come to mind. One is more about pulling information out in a timely manner. So just in time information about skills, for example. Nurses, like most of us, or like medical professionals, get a lot of training. They get a lot of didactic, education about all sorts of things, and they get to practice a couple of them. And some things are things you don't see every day. You see them very infrequently. I don't know about you guys, but for me, those sorts of things, every time I come back to them, whatever it is, some university procedure, I have to relearn it. I have to rediscover it. And it's because I just don't even make the effort to store it in my brain. Right? Go forward. So for them, if they know I'm about to go see a patient who has this issue, they might remember, wow, I sort of remember I had this, a class on this, and it would be useful for them to be able to pull out that information, maybe see some demonstrations if there's some technical aspect to it, some technique, lists of reminders, things like that. Yes, all of that could be done on the web, but however it's done technologically, that if they could ask for it in some convenient way and it was made available to them easily, that would be really valuable to them. And that is actually something that the nurses that I talk to overwhelmingly say would be really valuable. And like I said, they can go to the web, but not to denigrate nurses, but they're not technologists. That's not their job, and they're so they may or may not know how to use the web, but they do know how to ask for help. They do know how to say the right words to elicit it. So just-in-time skills is one. The other is kind of the other way around, is putting back in. By putting back in, what I really mean is sharing, that is talking to somebody. So it's sort of counseling, if you will. Nurses already, there's a trend toward journaling, well, not air quotes, it literally is journaling. Like at the end of the day, you could all imagine nurses' jobs are very stressful now, and just in general, even take the pandemic out, can be tremendously stressful. They deal with all sorts of bad things happening, the need to share bad news with people, your son's gonna die or whatever, your spouse, the healthcare providers in general having to deal with this, or people dying in front of them. And they have to pick that right back up and go back in and do their job and not transfer their sorrow or stress from one patient to another as best they can. And it's hard. So this sort of ability to cathartically share in writing or in some way what has happened, what transpired that day, good and bad, nurses have found is very helpful to them psychologically. So I think the agents could, again, both be sort of just-in-time information retrieval and also allow me to share. And kind of a little bit of a closing the loop on those two things that Ori and I and some others have been talking about is that I might share things that might be useful to other people. So if there was a way for other people to access in a clean way, that is maybe removing sensitive information or anything else, an experience I shared with my agent that is something that happened today, it might be useful for somebody else to know that, either the specifics of it or just that it happened, period, that it happened. You know, if I know that I say, you know, patient died this morning, 5-year-old boy, it tore me apart, and someone else has that experience later, if that other person's agent was able to make a connection and say, you know, Nurse Welch has encountered this also in recent times, if you want to talk with them, it could help facilitate that sort of connecting people up or sharing information. So those are two ways, two things.
I was muted.
Okay.
So I'm thinking about these modalities that are, what would be modalities that you can communicate with nurses throughout their busy day, and especially, you know, as busy as COVID-19 could be? How can we reach out on demand? But sometimes there will be just no time to sit and have a conversation with your agent during the day. So how can you imagine different, perhaps front ends to the same personal agent, or perhaps different modalities that could work during different parts of their very busy day?
Yeah, that's a really good question. You also made me think about another aspect of sort of the first question, but to answer that question, I think there could be, of course, voice interfaces, because nurses at times with neither hands, they're busy. They may be able to ask for something verbally and have it reported back to them in a way, you know, only they would hear. There could be an augmented reality interface at times. That might be the appropriate thing. I don't, you know, necessarily have direct evidence of this, but my own sense from my own research is that seeing is believing, and there's a power in seeing a real person, even if you don't always see that person. So the fact that I've met or in person and, you know, we've talked on multiple occasions, now I can talk to her on the phone and it's fine. I know she's there. I know who she is. She's a person, and I can share whatever. If I had never seen her and only talked on the phone, it's of course a very different relationship. So I think the modalities would come and go depending on the circumstances. Which brings me to the other thing that I realized, which has to do with the first thing, which is context. That's something 489 others have been thinking about, is context and proactive behavior of the agent. What I said the first question was, it'd be nice if the agent would give me just-in-time information. And I was really talking about when I ask for it. What about when I don't ask for it? I like to, you know, I tell people that it's like, I have one of my sons somewhere behind me, is the sort of kid where I can be working on something, let's say an electrical switch or something, and I will look and I'll turn and I'll say, can you give me and he will already have the tool that I need. He's got it right there. He knows what I need because he's watching and he's paying attention to what I'm doing. And there aren't a lot of people who can do that or who are willing to do it or able to do it. The agent, I think, could be proactive in that way, and maybe even prescient, maybe presenting things to me, knowing that I need them. But for that to work, it needs to be aware of the context. You know, it's not going to volunteer some information while I'm sitting in front of the 5-year-old boy and the boy's family. It's not going to say, oh, hey, so-and-so also had a, you know, experience with a child dying. That would not be a great thing to say in front of the child's family or the child for that matter. So there's a notion of being able to control when and things are disclosed in either way, and then how. Is it voice only? Is it visual, sound? Probably the primary modalities. Nurses in general, as you can imagine, very busy. So driving home might be a time when they could share kind of this, and I'm not saying this is my idea, this is what some nurse colleagues have said. They do already encourage nurses to sit and reflect at times. So at that time, maybe on your phone, maybe you see the agent, maybe you don't, maybe it's just audio, maybe it's augmented reality, so you see them on the chair with you in the living room while you're sharing with them. But nurses, like the rest of us, incredibly busy, so you're trying to time multiplex, families, whatever, all these things. So it could be that driving home in the car is a good time to do it. They have downtime where nurses will even they'll have like a 20-minute break, and sometimes they will go like into a closet, go into, I mean, it's both admirable and sad, you know, that they know they need this and they will go and hide in the supply closet to cry or to think or to close their eyes for 10 minutes or whatever it might be. So it could be that that's an opportunity for the agent to listen and to prompt them, you know, so it's not just turn on the mic and record. I think the agent has to, again, in a contextually appropriate way, be able to solicit things that are carefully chosen from social psychologists, for example.
So there are many people here kind of in the audience that are thinking about, including kind of the organizers that are thinking about working from cars. And it seems that I personally find the idea of work recovery during the drive home to be compelling. I can also imagine using the drive to the hospital to kind of convert and some mentally preparation from perhaps the busy life at home into a intense shift at the hospital. What do you think about that part of the drive? What could be helpful?
I love that. And I'll tell you a unique thing that I had never thought about before, but I just thought of when you said that is shift change, because you mentioned that. So if I'm a nurse, and again, I've vetted this with nurses, but I know what happens. They come in, there's a shift change, there's a handoff. So they talk to the nurse who's leaving and they try to learn everything, what's critical, all these sorts of things. Ambulances already do handoffs en route. So they will talk directly to the ER. If I'm on my way to the ER, I will be talking to the physicians and the nurses, and they'll be telling me, the EMT, what to do and asking questions and having that direct conversation. I think for normal nurses under normal circumstances, that direct communication while I'm driving is unlikely. But I think if it could be done asynchronously, that could be really interesting. Mm-hmm. So if the outgoing nurse was able to speak with his or her agent and say, you know, you got to tell Orate when she comes on shift, you got to worry about this, there's this happening, 10 o'clock, this, the family, whatever it is, some stuff. And the agent says, okay. And then asynchronously, I'm driving to work and my agent says, hey, here's some information from Orate about the patient you're about to see. This particular patient has these things, and could share that with me before I arrive. I think that nurses would be really receptive to that if it could work well, if it worked well. I think that would be very helpful to them, I think.
Great. Before we move on to questions from the audience, I just want to perhaps switch context from nurses, perhaps nurses dealing with COVID-19 crisis now, to all of us at home that are working under less than ideal conditions. And I'm thinking how agents could help us dealing with the stress of COVID-19 and perhaps helping manage our work from home in a more effective way.
Wow. That is that's a good question. So I'm trying to think, how is my home office and work context different from my normal work context with respect to that question? So what are the things, I'm just thinking out loud since we're just having conversations. I'm trying to think about what are the things that are different, like the interference. There's my cognitive interference. So there's my knowing that I'm sitting here and there are these other things that I need to do or want to do that are nearby, that are personal things, that are not work things, and they're distracting. So I don't know if there's something there. There's of course family, noises or other things. There are times when I'm on a Zoom call when, which is a lot, I ask people in the house to keep it down, and they might not. So there are times, when I've got this mode where this sounds really very kindergartenish, but it has worked, where I can clap my hands. I'll mute my mic and clap my hands down below the camera so people can't see it, but everybody in the house can hear it. So they know I'm trying to ask them to keep it down from whatever it is they're doing, the ruckus that's going on. So I don't know if, I'm trying to think if there are other things that are distinct.
I like this idea of leading to communication between agents. Perhaps my agent can see that I'm on an important Zoom call and can interact with my child's agent to say like, hey, can I help? Because mom is really busy at this point.
Yeah, no, I like that. I mean, I was trying to think of things that are unique to being in the home work situation, but even sort of normal, even normal circumstances, even if I'm working at work, physically, and then I come home, there's still that would be useful to me. I mean, one of the things I like we've always liked about agents in anybody who's done this and thought about it at all, it's not just me or my colleagues, but if the agent could, for example, help in tutoring or help just go through an assignment, and it might be very regular or very deterministic things that it can do. It might be more sophisticated, I don't know. But if the agent could look like, one of the cool things about visual agents in particular is they can look like anybody. So it could be Iron Man, you know, assuming you get permission from Disney, which I talked to my friends at Disney and we can't, but hey, anyway, you know, it could be some Iron Man like knockoff or whatever, some other character that might hold the attention of the kid a little more, might sway more, might have more influence than dad would or mom, because, you know, we're way down on the totem pole in terms of influencing our kids. You know, it could be the teacher's agent. I don't know, you know. And
I like the idea. Sorry,
one of the things I find very interesting we've learned is that there's a lot, I mean, this is not going to surprise psychologists, and I'm not a psychologist, but there's a lot of power in, so if the agent even just says, hey, I'm your teacher's agent, and your teacher wants you to do this, even if it's not true, it's like there's a lot of power in that in terms of encouraging kids to do things.
So I wonder if,
sorry.
I wonder if Shidan can jump in here because she has a question that I think is very, very in line with this. Is that correct, Shidan?
Yes, that's true. So I was reading the abstract and the reference to the movie Hair, and I was thinking that whatever agent I have been seeing an example of is more like an assistant with very much pragmatic or functional qualities with more or less predefined or learned tasks. However, that doesn't shape the trust to consider this agent as an otherness, which is a social partner. And I was thinking that except for raising levels of automation or algorithm powers or so on, what is the factor that makes maybe transforms an agent from a pragmatic or assistant to a social partner?
I think there are a couple things that come to mind. One is, one goes back to context and is awareness. And so I've seen this long ago. We did a study with EMTs on telepresence for roadside assistance. So an EMT is on the side of the road. They've got a case like a blocked airway or something, and they're not sure what to do. It'd be great if they could get somebody looking over their shoulder through 3D telepresence back at the hospital. A doctor or a nurse could guide them. What we discovered in our experiments, which really surprised me, was that there was a lack of trust. The trust was not that they didn't trust the individual. The trust was that they didn't trust that the individual, the remote expert, was aware of everything that they were aware of. They didn't fully, that the doctor, the nurse back at the hospital didn't understand all the things I was facing, all the things that were going on with the patient at that moment. So yeah, you're telling me to do this, but you have no idea. I've actually got this, and the patient's life is in my hands. So I'm gonna make a decision based on what I think is right. So in the same way, I think if the agent, so in the movie Her, she, Scarlett Johansson, was like aware of everything and, you know, omnipresent and really very subtle things. And so that quickly establishes, I think, for real humans, both a trust and a social connection. There's a project here at UCF that I don't have anything to do with, but one of my colleagues does, called Teach Live. And what I find really fascinating about Teach Live is a simulator for training teachers. And it's a virtual classroom with a bunch of kids, and trainee teachers stand in front of just a large flat panel display, and they teach the class for a few minutes. But like a flight simulator, you know, you don't simulate the 6 hours of boring flight over the ocean. You simulate the terrible things that can happen: the bird strike, engine failure, things like that. This teacher training is the same sort of thing. So misbehaving kids, you know, who are withdrawn, whatever it is, all those sorts of things you need to do. The thing that I find really fascinating is they did an end run around trying to make the students be AI-based agents. And they just have, because their goal is not the technology, their goal is to train teachers. They have a human. It's a human in the loop. It's just a Wizard of Oz sort of interface where there's a camera above the monitor that's watching the teacher. And so the kids now are being controlled, puppeteered by this person who comes to be called an interactor. And what is so powerful is the moment that the teachers realize that those kids are aware of what they're doing, things that maybe they're not even aware of, like rolling the eyes or a body pose, like a, you know, tilt of the head or something that might convey that, I don't really believe you, or yeah, whatever. I mean, the kids are immediately aware of that and react. And so there's this very tight feedback loop that you don't normally, it's hard for me to imagine with autonomous agents. But what I realize about that is the importance of that awareness of the agent, and the proactive things. So that's another thing that's very important, is that they found that if the student says something like, oh, that color purple doesn't look good on you today, or whatever, something, it's just, if they're high school students and they're being snarky or whatever. The fact that the kid knows that I'm wearing purple and would say something like that is very powerful to making that social connection. So I think trust, and it's not just, again, trust in the person, but trust that the agent is aware and also reliable. It's a trusted system, for those of you who know it, getting things done kind of paradigm or philosophy. So it's a trusted system. The agent is reliable in that way. And the agent is trusted in that the agent knows what's going on. Because none of us, I think we all probably are like, you've been in a situation where you explain something to somebody and it's too much trouble to explain to them all the details and they don't understand. And you end up just saying, look, don't worry about it. I'll just deal with this. And that's not helpful, right? It would be more helpful if they really did understand and they were able to take that burden away from you and take care of it for you, or listen or share.
Okay.
Talking about listening. Oh, sorry, go ahead.
I just wanted to ask if that's published and if I can have a link to that.
The Teach Live there are lots of papers on it. So it's just TEACHLIVE, one word, concatenated, but any variation of that, I'm sure you'll find it. There are lots of papers. There's actually a company, a spin-off company in the Bay Area called Mursion, MURSION. I think it's like the Southern US drawl version of immersion, but it's Mursion, MURSION. And they have clients like Best Western, big hotel chains. So like front desk personnel learning to deal with others. So it's really for training social interactions, customer service, sort of things like that, teachers.
So Vidya, I was wondering if you wanted to ask your question about, I think that ties in well with this connection that we just finished with.
Yeah, sure. I was fascinated by how you were describing virtual agents being able to help with, content-related information for healthcare professional nurses in particular. I'm an occupational therapist, sort of a related field. And in my field, when days get busy and crazy, what really helps me sort of re-energize is those casual conversations that I have with my colleagues in the hallway, like just acknowledging that today's been a crazy day, or client in that room is acting up, or, just that quick sharing of information that's unplanned. Do you see a role for virtual agents in those situations?
I do, ideally. I do, but there's, because I'm a technologist, it's hard for me to let go. It's hard for me to bridge between what I know we could do today and what could be done. So I think transactional things, at least I'm willing to believe they could be done well, and I could believe that this is real. That sort of very tight, intelligent conversation, I think it would be valuable if it could happen, but I don't know. I mean, so Ori and I, and others have talked about, as an example of what you're saying, is your agent might, for example, this happens, there's workplace violence, and they call it workplace violence, right? In the medical, you would know. There are papers on it, and it doesn't mean necessarily physical contact, but even just some sort of form of abuse. It might be verbal, and maybe it's heat of the moment, maybe it's systemic, I don't know, but let's just say a doctor yells at a nurse for something that happened, might or might not have been the nurse's fault. So when the nurse leaves the room, it would be cool if, number one, the agent knew that in the room was not the appropriate time to say anything. So to wait until you were alone with the nurse, and then the agent could proactively say something like, wow, what was up with that? Or, what was that about? Or what's he upset? I mean, I think a big part of this is a big part of the technological trick is to identify, aside from the technology, identify the sorts of things that could be said and done, and the way they can be said and done that are safe, that are, generic enough that they're appropriate for those circumstances, but they're not so specific that there's a danger of saying something specific that's wrong. Because the minute there's the absence of anything. If I say nothing, that's one level of connection, which is very little. If I say something, there's a chance for greater connection socially. But if I say the wrong thing, it's going to have the negative effect. If I say something like, wow, she was silly, or something like that, when it was a man and he was yelling, it's going to be like, I'm suddenly going to have no use for my agent. Turn that thing off.
So let me actually bring in Albrecht, because he has this question, right? His question is exactly related to your last comment there.
And I think sort of for me, the virtual agents, they have been around the corner since 1998, since I started my PhD. And I think we were always just a bit away from having them good enough to work. And I think you just brought up this point. I think if we have an agent that has, let's say, 100 conversations with us over the week, that would be not very often during the day. If one of them is seriously wrong, that's the last week I used it. And I think we had recently more discussions on how bad Alexa works. Alexa gets it wrong 3 out of 4 times. And obviously, sort of, I think there are some known issues, but I think the idea of creating a virtual agent that gets it right more than 99 out of 100, which I think we would need in these complex scenarios, I think that's so far off. So my question is the virtual agent really the right thing? Or is a system that gives me sort of options in a way where I make the choices rather than the proactive thing not the better way? Because I don't really see that this is going to happen in the next 50 years.
I think my response to that is that one thing I've recognized is, well, first of all, yes, I think it is worthwhile. I personally think it is. I think for me, it's one of the most exciting, tantalizing things. And it's tantalizing both because I personally think it is, and because of the existence of Amazon Echoes and Google Home, whatever, Apple, Siri, whatever, all of this, it's coming. People are trying, everybody kind of, there's momentum. So I feel personal excitement to it, and I think it's still worthwhile. The thing I've been trying to think about is, or I've been thinking about a lot lately, is in the past, I think I, and maybe others, but I'll speak for myself, have been guilty of trying to solve everything perfectly. So trying to have an agent that's general purpose and it can do all these things. And that's a super high bar, which probably we'll never achieve, maybe, I don't know. But instead, I've realized that there's probably value to focusing in on a particular domain, nursing, maybe particular circumstances, and trying to find the places and the niche in where we can have a much higher chance of success for that and be useful for that particular thing at the expense of not doing everything. And so that's one of the things I've really been trying to think about. And it's in the spirit of that is what I was saying earlier about, I feel like there's so much probably, it may exist in the literature, but may not. There's probably a lot of work to be done that has nothing to do with the technology directly, which is about the circumstances, the language, the preemptive or proactive things that should or can be said, safe things, how during the like if a nurse is journaling or having this cathartic discussion with the agent at the end of the day, what are the right ways? If it was just a human, forget the agent, if a counselor was sitting here with me, what would the counselor ask? How would they ask it? Why would they ask it? What's their thinking process? So if we could capture some of that and do it in a minimally risky way and get success just on that counseling, forget all of the other things, I think that could be very valuable, especially if you could then mine the results, safely mine the results of the disclosures for valuable things or connections or whatever, if there was a path toward doing that. So I'm still optimistic. I think the trick for me personally is I'm trying to find places where you can constrain the problem in the domain to something that's doable and doable well enough to make an impact, such that the nurses and people find it valuable. I mean, I'll say nurses, it's kind of like I've experienced in the past, like people in the military are like, kind of like little kids in the following way. Children, I've heard somebody else say this long ago, children have no patience, right? If you give them some widget and it doesn't work, they're gonna throw it away and they're gonna be on to something else. Most adults are polite and they're like, oh, well, if it did this, I could use it. And maybe I could use it if I twist this way. And so they're trying to make it work and they're trying to be polite. nurses, and I've seen this in the military, they have no patience for that. They got better things to do. They've got, and so if it doesn't do something that's valuable to them, they're out of here, So that's another reason, again, why I try to focus in on things that can have some success in.
Since we have a couple more questions, we'll run a little long today. And Greg, you mentioned safely using information. So Diana had a question about this, related to this. So I was wondering if you could just tell us.
Sure. So my question, I was just wondering how informed consent would work with these agents. So like issues of privacy in a few different settings. I remember we were talking about children interacting with the agents. So like, does a child understand the privacy implications? Is that up to the parents, or more related to hospital settings? What about patients who are really ill and may not understand what's happening, like too ill to grasp what's going on? How do you get agents to interact with them?
The short answer is, I don't know. I can't give you a good answer, but I will tell you some thoughts I have about that, which are that I think there are a lot of things with agents that are very parallel to things with humans. So it could well be that there's a lot that we already do that's already in place for humans that faces that same challenge. If a person's going to go sit in a room with a dying patient and have a conversation, there's a consent issue there. And so I don't know, how that's been addressed, if it was a blanket consent when I checked into the hospital, or whatever it is, but it could be that it could be handled through that. I think the difference maybe here is nothing's black and white, but I think the difficulty here is that when you're talking to a person, it feels just in general less likely that what you say to them is going to get out and go somewhere else. When you're talking into a computer, probably most of us feel it's more likely that, in fact, the chances are it's going to get out in some way. So again, or 8, 9 of the others have thought about how do you control that, and how do you give the person a sense that it's being controlled, that you're governing that in a way that what I'm going to tell you now is not to leave this room, something like that. That's what you would say to a human, and you would say that, and there has to be some behavior probably about the agent that confirms that the agent understands that, and there has to be trust that they're going to do it. So, for example, the agent probably shouldn't just say okay, because that's not very comforting. But maybe the agent has to respond and say, okay, I understand that what you're about to tell me is very sensitive, and it won't go beyond our conversation, or something like that. We've also discussed, or 8, 9 others have discussed, like, what do you do when and this is the same for, like, say, priests in confession, or medical professionals. What if I say something that is indicating harm to myself or harm to somebody else, for example? At what point legally or how otherwise can the agent then share that information with somebody else, proactively send that information to someone else, that Greg is in trouble and he needs help, even though he doesn't know it and he's asked me not to say this. I need to share this with somebody. But again, I think probably, I believe, and I haven't studied this, and I just can't, I think that a lot of those policy and legal issues could very well be addressed by many things that are already existing in technology and human interactions today. At least a good start on them. They might need some adjustments.
So I think we have one last question from our audience. And Chris, you were talking about sort of a different take on the working in parallel.
Right. Yeah, some of this you already addressed since I wrote down the question. But I'm wondering whether an agent isn't really tied to a physical place, right? Whereas a doctor or a nurse, they can only be in one room at a time. So can these virtual agents play a bridging role, in the sense that my doctor might be somewhere else, but the agent might be able to get, and I'm the patient, the agent might be able to get some information from me, or pass on critical agent information from me to the doctor. And I was thinking of the movie Her as well, right? Where the operating system is working in parallel with lots of people, but nonetheless, I as a user have a personal experience. And clearly that isn't the right form, how they did it there, but for a hospital, but in what way could there be that parallel working and that bridging function between parties?
I love that. I mean, you guys are like setting me up for all sorts of great stuff. So it's a great question. And I'll tell you that the agents here, we thought about not just for nurses, but also for patients. Okay. So the circumstances you just gave, I mean, an example, something that comes to mind is, and this happens all the time, you can imagine. First of all, you're a patient, you're in a room, you're bored to tears. There's nothing to do if you're conscious and you're just going insane. And so probably time is magnified or scaled, so like when I press the get me help button, I have to go to the bathroom. I need help, it's like, man, and then you wait and nothing happens and you're buzzing again. And so you're frustrated because to you, it seems like an hour has passed, maybe it's been a few minutes, but you probably don't get a lot of feedback. Sometimes you don't. One thing we've thought about is, again, this asynchronous communication of the agent being with you in the room. If you said, I need to go to the bathroom, the agent could say, got it, I'm going to work on that for you. And then you might have some trust that the agent, whether it's true or not, I mean, it might be the same mechanisms pressing the button. It might just press the button. I don't know. But it's interesting too, this leads into a whole other thing, which I don't know if any of my students or the researchers are on the Zoom call. I see one, Nahal Narusi, but I'm really interested in also the psychological aspects of that interpersonal interaction. So if the agent says to you, we've done studies that show that if the agent says to you, I'm going to go get help, and you see the agent actually walk out of the room or disappear in some way, we think something's happening, whether it is or not. We feel better about it. And it's interesting because hospitals today, and this sounds a little bit mercenary or crass, but it is what it is. So say under Obamacare, one of the things now is hospitals will get dinged. They will lose money. They'll lose Medicare money if patients aren't satisfied with their experience, if patients are frustrated when they go back by federal law, they have to fill out a question, or they're supposed to be given a questionnaire and they fill it out, the hospital gets rated. If the ratings go down, they get less Medicare money. So hospitals are really motivated to make the patients feel better about their experience. Whether or not they're actually medically better or not, it's a separate issue. So to have the agent give some comfort that something is happening on my behalf, I think asynchronously is, really, really interesting. And never mind also the whole other side of things, which is, we've talked about this too with like agents for children. Children are the worst in terms of being bored. Kids are, as a friend of mine once said, it's worse than a stick in the eye. Give me something to do. Kids go crazy. So we've talked about, having agents that could be company for children. I'm really intrigued by a thought that I haven't tested, but we've done some experiments in the past with something we call contagious social presence. So if I see an agent and I just walk up and start talking, that's one level of interaction. If I see two agents in front of me visually through augmented reality or on a flat panel display, and they're talking to each other, that suddenly changes how I feel about both of them. They're my expectations, my trust that they're going to understand me, whether or not it's true. Just seeing them having a conversation is important to me. So we've wondered about for children, if there are agents, maybe what you really want are two agents, two children who are playing with each other. That way, there's both that increased sort of boost of social presence, but also the child doesn't have to feel sort of on the spot all the time, or the person. It's not my job to entertain this other agent. If it was one agent, you'd feel like all the time, like I got to tell jokes, I got to do something, keep this agent occupied. Otherwise, it could be just like two kids off playing. And if the two kids off playing a game are occasionally aware of me, the child patient, can say something or, react to words I say, it could be a really nice level of comfort and aside from anything medical, just for those patients.
So this is very, very compelling. I know that I personally could continue this conversation, but I would like to stop here the formal part of the conversation. I'll remind everyone that next week, Reagan Mandrick will be here from the University of Saskatchewan, and she'll be talking about the benefits of digital gaming. I would like to thank Greg very much, and hopefully you can stay with us a little bit longer for a conversation, but thank you very much for this conversation. And we can stop the recording now, and we can just transition. Feel free to jump in with any questions or thoughts.